Gone are the days when a master's in OBG was a big thing. We have entered a new era. Today, the patients are asking for a specialist. So, what's your plan after OBG? Infertility, fetal medicine, and gynec-oncology, everything seems oversaturated. It is already there in every street of every city. If you're looking for something new, something exciting, urogynecology and reconstructive surgery is the newest branch in OBG. With a very few dedicated urogynecologists, you have an immense scope to carve your future. The best thing I like about it is it's such a good balance of clinical acumen, surgical skills, plethora of possible imaging tools, and loads to research. And if you are the one who loves to make a niche for yourself, I have a good news for you. From 1st December 2023, yes, you heard it right, 1st of December 2023, we are starting a fellowship program in urogynecology and reconstructive surgery for 2 candidates per year at Shree Mookambika Institute of Medical Sciences, Kanyakumari, Tamil Nadu. I don't believe in promises, but I believe in doing it. So I'm taking you through my journey with my first 2 fellows. That has finished actually today. If it ignites a spark inside you, feel free to call us. The number is 7871080250. This a year-long journey started exactly 1 year ago on 2nd of October 2022. During this time frame, we were able to give outpatient care to 646 women. Outpatient care included the diagnostic workup, outpatient management, including post-operative follow-up of various urogynecological issues, including pelvic organ prolapse, urinary incontinence, voiding dysfunction, recurrent cystitis, painful bladder syndrome, fecal incontinence, and various kinds of genital fistulae. The outpatient care also involved interdisciplinary management in the form of urodynamics, ureteric stenting, pelvic floor muscle training, and imaging in radiology. A total of 219 women were admitted for inpatient care, where the fellows learned about the preoperative workup and also the postoperative care of patients who were recruited mainly for urogynecological surgery. Not a lot of it, but they also got a chance to participate in labor care and childbirth, what we call as preventive urogynecology. In this 12 months time frame, we did a total of 186 surgeries, which included vaginal hysterectomies, colporrhaphies, perineorrhaphy, mechalcaldoplasty, colpoclysis, Fothergill surgery, non-descent vaginal hysterectomy, cervical stempectomy, sacrospinous ligament fixation, sacrocolpoplexy, open as well as laparoscopic, abdominal VVF repair, open as well as laparoscopic, and we also did vaginal VVF repair, TVT, that is retropubic tape, transobturator tapes, total laparoscopic hysterectomy, laparoscopic cystectomy and ovariotomy, sphincteroplasty, urethral diverticulectomy, and also cystoscopy, which was sometimes diagnostic and at times therapeutic too. They got a chance to assist me for 92 cases. Independently, they were able to perform around 45 cases, each one of them. The first fellow did around 47 cases and the second fellow 44 cases independently. Trust me, I was just present as a backup that time. Though urogynecology 80% is about surgical management, however, you need to have a very strong theoretical basis. My fellows got a chance to have 46 theory classes during their tenure, and out of those, 36 were physical classes and 10 were online classes, by the experts in the field. The fellows were also involved in research activities. As a result, they already have 2 copyrights, 1 published paper, 3 papers are in the process of manuscript submission, and 2 have already been sent for publication. If you're feeling that this is too much to do in a year, they also organized a national level conference, Urvashi, Urinary Recto-Vaginal Health and Shree, in January this year. Believe me, I was just the thought behind it. The entire credit of successful culmination of this conference goes to my 2 fellows who were the scientific coordinator, and despite their hectic work during the conference, they also managed to participate in 2 sessions, case discussion on VVF and a debate on a burning hot topic of the era, tape or not to tape in SUI. In the month of May, all 3 of us went to attend a conference, a state-level conference which was organized by the Uttarakhand Society of Obstetrics and Gynecology. We went as invited faculty, and they assisted me for 3 live cases and participated in 2 case discussions, and also contributed for a chapter for their souvenir. As the representatives of women's health, our responsibilities don't end at just treating those who come to us. We must give something back to the society. And the least we can do is to make them aware and empower women. And for this cause, the 2 fellows took part actively in creating awareness about pelvic health in 2 events. And finally, it was time for their evaluation. They had 2 theory papers and 1 practical exam. And I must say, I'm really proud of my 2 fellows, Dr. Suvriti Bansal and Dr. Dheera Samdaria.
Hi, I'm Dr. Suvriti Bansal. During the past year, through the course of my fellowship with Dr. Diksha Pandey ma'am, I was exposed to the vastness, the scope, and more importantly, the need of excellence in the field of female pelvic medicine and reconstructive surgery. Apart from the fact that she's a great teacher and an amazing human being that you'll fall in love with, this whole program was curated to make us traverse through the basics in order to understand the most complicated of pathologies. We learned compassion, cutting-edge clinical acumen, and got abundant hands-on exposure in a variety of vaginal as well as endoscopic cases. Today in my clinical evaluation, I feel I'm way more thorough and I'm definitely a more confident and calculated surgeon. All thanks to this year that I had with ma'am, which was dedicated towards the cause that we all truly believe in, and that is to improve the women's healthcare in our country. Thank you.
Hi, I'm Dheera Samdaria, and I recently completed my 1 year of fellowship in Urogynecology under Dr. Diksha Pandey ma'am. To say the least, it's been a very enriching and a fulfilling experience. In the last year, we have understood urogynecology, yes, as a holistic subject, but also as a specialty subject. It's been a complete learning in the sense, be it academics, be it clinical work, be it research, and surgical experience covering the whole spectrum of pelvic floor disorders. Diksha ma'am is a very passionate teacher, a very patient clinician, a brilliant surgeon with an astute research mind, and we consider it our privilege, and we are extremely thankful and grateful to have had this opportunity to learn from ma'am. Thank you.